So we'll begin ensuring all can thrive in STEM. So first we will start with a video that will tell us a little bit more about introducing reproductive justice.
Reproductive justice. A lot of people talk about it, but many don't know what it really means. Here's the basic idea. Coined by 12 Black women in June of 1994, the term is the combination of two phrases, reproductive rights and social justice. The new phrase reflected the lives and experiences of Black women in the United States who had been denied a full range of services and protections. Black women have multiple identities, like age, ability, sexual orientation, immigration status, religion, and nationality, just to name a few. Consider the fact that Black women experience some of the highest rates of poverty and only make 63 cents for every dollar a white man makes. Nearly 20% of Black women have no health insurance and die 4 times as often as white women from pregnancy-related causes, regardless of income or educational status. The issue at play here is intersectionality, a term coined by legal scholar Kimberly Crenshaw, which refers to how multiple systems of oppression work together. Reproductive justice is how we take on all the systems that harm us. Reproductive justice is the human right that can only be achieved when all women and girls have the complete economic, social, and political power and resources to make healthy decisions about our bodies, our families, and our communities in all areas of our lives. Reproductive justice centers the leadership and lived experiences of the most vulnerable, including but not limited to Black women, women of color, LGBTQ people, and youth. So there you have it. Reproductive justice has given thousands of women a framework to change policy, improve services, collaborate with other social justice movements towards our collective liberation. For more information, contact In Our Own Voice at www.blackrj.org. Thanks for watching and welcome to the movement.
I think that's a great place to start, is really centering those who have been in this movement and who have really started this movement. So for those who are more static visual learners, reproductive justice, once again, is the human right to maintain personal bodily autonomy, to have children, to not have children, and to parent the children we have in safe and sustainable communities. And this is a definition put by Sister Song, which is one of many organizations that do this amazing work. And one of the parts that I really love that we had in our training at 500 Women Scientists was Jaleesa Jackson, who is an activist and educator. She really connected the dots for us that I thought was important for us to connect for you. And that's so what does reproductive justice look like? So it looks like livable wages. As discussed in the video, we know Black women make 63 cents to the dollar of white men. And in order to be just, we have to have livable and fair wages. We deserve freedom from violence and discrimination. I think right now in the media, we are on this terrifying loop of instances where we're seeing Black and brown people killed, especially by police states. And reproductive justice looks like being able to raise those children to be free adults who are able to live their lives free of violence, which is important to us. It looks like having adequate prenatal and pregnancy care. Black women are dying during pregnancy and childbirth, and having adequate care would lessen those instances. I think one of the most recognizable times is a legal right to abortion, which is probably what a lot of people know about reproductive justice. And it's, yes, the right to not have children, but also the right to have children. Access to affordable healthcare is important. Honestly, I have gone without healthcare, and even when I've had healthcare, I have foregone treatment because of the bills that are associated with it. And then lastly, which is a really big part, is comprehensive and LGBTQ inclusive sex education. We've recently seen a pop-up of bills like in Arkansas where they're targeting trans youth. And we know that justice for all means that everyone has great education, healthcare, and access.
All right, thanks, Lauren. So I wanted to put this in the context of some other data that we know exists. Given we are all scientists, data is an important piece, but of course not the only piece in these kinds of conversations. So when we look globally, the US is not faring very well compared to other rich nations when it comes to maternal mortalities. This is inexcusable given the resources that exist in the US. And I wanted to make clear that was where this stood. If you go to the next slide, Lauren. And at the same time, we did want to acknowledge that globally, there is disparities across nations. And in that lens, the US is faring well in terms of maternal mortality. But the focus that we wanted to put on this presentation in thinking about reproductive justice is this disparities within the US and within other countries, specifically with respect to racial disparities. So this was mentioned in the video as well, but if we're looking at the amount of pregnancy-related deaths in the US, we see 13 per 100,000 live births for white women, and then 3 to 4 times that level of death in pregnancy-related death for Black women, and you also see increased rates for American Indian women and Alaskan Native women. And so we really see these huge disparities, and these exist even when we control for things like income and education and pre-existing conditions and other things that you might think confound that data. And so, we can, among other things, we can literally see the medical racism when we look at the data. And so I wanted to draw out that point.
Yeah, and so one of the great things is, we can't talk about the problem without talking about some solutions that are helping the problem. And so first we're gonna talk about community level solutions. 500 Women Scientists is a huge proponent that a lot of change starts within the communities and should be affected by those who live and have those lived experiences. So some of the solutions are doula trainings. And if you don't know what a doula is not a healthcare professional, but more like a collaborator that's present and provides emotional, physical support and kind of like advocates for the pregnant person. And we know that the presence of doulas actually improves birth outcomes. And actually in a lot of major cities, they have these programs where, like, I'm based in Atlanta, where they'll actually go into like the communities, like Black communities, and find people who are interested in becoming doulas and train them and then provide that service to those in the community, which I think is the most important way to help enact change. And then there are also things like support networks. Pictured here is Centering Pregnancy, which they actually do their prenatal care. Instead of it being one-on-one, they do it in support circles. So it's like this big group of pregnant people and their partners, and then they learn prenatal care. And that actually has improved outcomes just by having kind of multiple people there aiding in your journey. And then another great proponent is also self-advocacy. And we don't say self-advocacy to say that these are not issues at a systematic level that need to be addressed, but just that it's important for people to know their rights and how to advocate for them. And there was last week, a love letter released to Black birthing people from Black health workers, physicians, midwives, and they gave a list of some things you can think about in advocating for self, like finding culturally and race competent care, advocating for second opinions, prioritizing mental health, because we know that Black patients fare better when they are treated by Black healthcare workers, but we know that less than 3% of doctors are Black. So we need to not only have more Black physicians and workers, but we also need to increase cultural competency in care and address the medical racism of the system.
And there's also lots we can do at the policy level. And I did just want to say, I meant to say it on the previous slide, but there's a ton of data and articles and resources and case studies on documenting the problem. So if the topic is new to you, I would encourage you to research that. There's lots of good news articles and storytelling around this disparity and what it looks like and what it feels like for people that are affected by it. So I would encourage you to check that out if you are interested in that, and to look at what disparities across demographics might look like in your own country if you are not US based, because this isn't a uniquely US problem, although we're focused there as being based there. But we also wanted to be solutions focused. So this is some more of that. So at the policy level, there's lots that we could do to address this problem. And there's some evidence of success in thinking about that. So some of that involves just sort of putting policies in place that allow for or better resource the community level solutions that Lauren talked about. So one example of that is there just recently was introduced the COVID-19 Safe Birthing Bill in the US Congress. And what this does is just say that you have to allow a doula or other pregnancy support person into the room in a hospital. And this is important to mandate because under the pandemic, that has not been the case. And many women who went into labor were told they could only have a single person there. So if they have to choose between a partner and a support person, they don't get to have their whole team available. And we know that is a factor that can help with some of these outcomes. And so just ensuring that people get to have that support in the room is a big deal, especially during COVID, where that was more restricted. And at the state level, we've also seen some cool initiatives. In California, they have an initiative that's been in place for several years to really use data to be cognizant of care and how equal care is being given in hospitals. They have programs where they are very systematically measuring outcomes, tracking patients and risks, and making sure that that is consistently applied across hospitals and across patients. And they've done all that using a lot of data at hospitals and being able to really track things well. And this is one of my favorite ones just because you can see it in this graph. You can see that it's working very dramatically. And so this is, it's sort of rare in policy. You have sort of like this clear of a benefit. And so I was very excited just to see that in the data. And so there's lots of things we know how to fix this, and we've really seen the outcomes. And then the last policy proposal I wanted to talk through was the Black maternal health Omnibus package, which is something that is being talked about in the US Congress right now. It's been introduced, and this includes all kinds of really neat stuff inside of the bill. It's looking deeper at some of the social determinants of health. It's making sure that people have culturally congruent maternal care available to them. It's funding community organizations to do this work who know their communities and know how to reach people in them. It's bolstering the data collection to make sure we can track these disparities and work to address them. It has a particular focus on incarcerated moms as another category of people who are at greater risk on these issues. And it even includes things like climate change related risks that multiply under the scenario. And so there's a few people in Congress now who are really focused on this issue and thinking about the policy solutions to it. So I think it's a good time, at least in the US, for pushing these issues, because it's something where we're seeing more people focused on it. There's a little more interest in these issues and the maternal health disparities by the presidential administration. So it's an opportunity to push some of these issues and get more policy solutions enacted.
Yeah. And so how we actually, as 500 women scientists, came into really centering and learning the reproductive justice framework was myself, the co-founder, Jane Zelkova, and then two of the members of our Atlanta local chapter attended this abortions brunch and conversations event last year, or 2019, when the bills in the South started rising against abortion, or trying to outlaw abortion. And Jaleesa Jackson she did a small refresher course of what reproductive justice is. And we thought that this was extremely necessary for us, not only just as people, but also as scientists, and what that looks like to incorporate this framework into our science, into our journey in science, and as we become mothers and parents, and what that looks like. And so I want to really reiterate, it's important for us and it's important for you to know this framework, to understand and see how you can incorporate it into your life, but also your science. And I know, Gretchen, you can tell us a little bit more how you kind of came into this.
Yeah, so I wanted to talk a little just about my perspective and what sort of brought me to this issue as a white woman. And this was when or one of the motivating factors for me was becoming a mom. And my first was born. When he was born, he had to go to the NICU, the neonatal intensive care unit, for about a week. And he had a couple minor medical problems, but he kept having to stay there. And so I was forced to be there and try to breastfeed him. And of course, as many of you know, that's very hard. And I just felt this primal need to protect him and make sure that he could do well. And he was, from the look of it, he was the biggest baby in the NICU that I saw. And I thought, well, that's really lucky. I'm lucky that he was born pretty healthy, and that was good. But the reality, of course, is that it wasn't that I was lucky, right? It's that there are factors stacked against other people's ability to have a healthy baby that thrives full term that I didn't have to face as a white woman with relative privilege. And it made me just think more about those inequities, because as you all know, pregnancy and birth and labor and raising a child is so hard. And no one should have to face additional barriers to that. And we all deserve to be able to have children, and ourselves can thrive. And it just makes me very angry that not everyone, that people face additional barriers to that. And the fact that Black women are forced to do all those hard things with even more factors stacked against them is not okay. And so I just really felt that emotional pull to do something about this, because it's completely unacceptable. And being a mom is only one way that that issue intersects with us. As scientists, we wanted to also call out the many other ways that these issues come into our lives, and that's in all kinds of places. It's in the way that we engage ourselves civically. It's in the voices and stories and issues that we choose to elevate in our own voice, in our own lives, on our platforms. It's the research questions that we ask and how we frame those and what we choose to do in our scientific work. And I'm going to pass it back to Lauren to talk a little bit more about that.
Yeah, I think one of the huge things is human subject research. In my graduate work, I worked with a study that looked at trauma and transgenerational trauma, and how a pregnant Black mother and what the effects look like on her child. And when one of the PIs of that study was presenting it to my graduate class, it was very traumatizing, because it was done in a very much like case study way, and it was like there was no emotion to it, no like recognition that this is like a human being you're talking about who has these barriers and that deserves these rights to be able to raise their children in free of violence and destruction and those things. So we really have to be careful about the way we talk about this work, the way we engage with this work, and that we are really centering the most vulnerable and protecting them and uplifting them. And I think as scientists, we know that we follow the data, but we know that there are disparities in grant funding, that there are disparities between what science is uplifted and advocated for. And so we think that this is, our purpose to do this work. And it's your purpose as well, as we're all scientists, and this is what we do. I know we're coming up on time, so I'm just going to finish it pretty quickly, but just that support is a verb. It is a verb. So you have to listen, learn, educate yourself. because a lot of this work is already out there. And so you take that time to learn and to see how you can show up and support these organizations and how you can incorporate this framework into your science, your institutions, your policies, and also our daily lives. And then I just want to end with recognizing that there are a ton of organizations, but here are just some. I really emphasize, looking at organizations that are Black-led, because you look at organizations who are most impacted and you follow those people who are doing this work. So there are a ton of them. Black Mamas Matter Alliance, we just had Black Mamas Week, the National Birth Equity Collaborative, so many, Sister Song, Sister Love, please check them out. And then here's also a book list where you can get started. There are so many articles written. Gretchen has also written one about the perspective of how to get white women to stand up and fight for this. So there's a lot of great things out there. And with that, I will say thank you so much for having us. And if you want a copy of the slides or want to know more about what 501 Scientists is doing to help, there's the email for you to contact us.